Hello everyone, my name is Brianna Worthington and today we're going to be learning about dislocation sports injuries. So here's a quick brief introduction. A dislocation is when two bones that come together to form a joint become completely separated. The joint is described as dislocated. Contact sports such as football and basketball, as well as high-impact sports and sports that involve significant contact, falling, or extreme loads cause most dislocations. A dislocated joint typically requires immediate medical treatment to return the bone back to their correct place, but sometimes the bones move back into place on their own. A dislocation is a painful injury causing swelling, a deformed appearance of the joint, and an instability to move it. These are most common in shoulders, elbows, fingers, kneecaps, and femur and tibia or knee. A dislocation can either be acute, sudden, or chronic long-term depending on the injury onset and how long it persists. So dislocations are also classified by the location and type of injury. So it's anterior dislocation, recurrent dislocation, and congenital dislocation. So an anterior dislocation is when the head of the humerus bones moves forward and out of the shoulder socket. Recurrent dislocation is the repeated displacement of a joint from its normal position, commonly affecting the shoulder, and it's caused by damaged ligaments, underlying structural abnormalities, or genetic factors. And last, congenital dislocations is a condition where a joint is dislocated at birth, most commonly affecting the hip or less frequently the knee. And there is also classifications based on how far the bones in your joints were moved. So complete dislocation is luxation, which is a complete dislocation happens when the bones in the joints are completely separated and pushes out of place. And subluxation is a partial dislocation, which is something that pulls your joints back apart and the bones are still touching. So here's like a little graph and like a comparison of a normal anatomy of a shoulder and a dislocation shoulder. And then moving on, we're going to be talking about the muscles and bones that are impacted. So a dislocation impacts the bones at the joint, pushing them out of their normal position, and also affects muscles. Ligaments connect bone to bone, tendons connect muscle to bone, and cartilage in the surrounding area. So almost any joint in the body can be dislocated as far as the larger joints, which are the elbow, hip, knee, ankle, and then smaller joints as the fingers and toes or even joints of the jaw. And then we have our categories explaining everything. We'll talk more in depth into it. So we have the bones, muscle and connective tissues, nerves, and blood vessels. So for bones, so when you dislocate a shoulder, the head of the humerus is displaced from the shallow socket of the scapula. When you dislocate a hip, the femoral head is dislodged from the hip socket. Elbow, bones in the elbow joint such as the humerus and ulna can be dislocated, and fingers and toes, which the bones in the smaller joints of the fingers and toes can also be dislocated. So moving on to muscles and connective tissues. So the ligaments that are torn from a dislocation, ligaments that hold the bones together are often sprained or torn during a dislocation. Tendons, which are attached to the muscles to bones, can be strained or torn. Muscles can be strained or torn, so for example, with a posterior shoulder dislocation, the strong internal rotators like the scapularis, the latissimus dorsi, and the pectoralis major can be severely affected. And lastly, the cartilage. So the smooth cartilage that occurs at the ends of the bones within the joint can be damaged, which may lead to long-term issues. And then moving on to nerves and blood vessels. So the nerves, such as the axillary nerve, this is the most commonly injured nerve in a shoulder dislocation. It supplies the deltoid and teres minor muscles and can cause numbness or weakness in the shoulder. The brachius plexus is a network of nerves that runs from the neck to the shoulder, can also be compressed or stretched, leading to numbness, tingling, and weakness in the arm, hand, and fingers. And then the blood vessels. So the blood vessels near the joint can be stretched, compressed, or torn, which can affect blood flow to the area as well. And then down here is kind of like the graphs for each of them. And then moving on to symptoms. So, common symptoms and physical manifestations of a joint dislocation include intense pain, visible deformity of the joint, swelling, bruising, and a limited or complete inability to move the affected area. And we're going to be talking about each of the common symptoms and physical manifestations. So, with the common symptoms, so common symptoms include severe pain. So, pain in the injured area is typically intense and often worsens with any attempt at movement, limited or no movement. There is a severely restricted or complete inability to move the injured joint normally. Numbness or tingling, so nerve compression or damage can cause a loss of feeling or pins and needle sensation, which is a paresthesia in the area around the joint or further down the limb. And then lastly is the instability. This affects the affected joint may feel loose or weaker than usual. And then moving on to the physical manifestations. So the physical manifestations include visible deformity. So the most obvious sign is a joint that looks mishapen, bent at an abnormal angle or clearly out of place compared to an uninjured side. And then next we have swelling and bruising, rapid swelling and bruising, discoloration of red, typically develop around the injured area. Um, then moving on to tenderness and warmth. So the affected area will be tender to touch and may feel like a little bit warm. Then we have muscle spasms. They may involuntarily spasm due to the trauma. And then lastly, we have the popping sensation or sound. In some cases, a person might feel or hear a popping sound at the time of an injury. And then we're going to be moving on to treatment. So, a treatment plan for a dislocation includes immediate first aid like immobilizing the joint and applying ice, followed by professional medical care for reduction, which is the repositioning the bones back in their original place, immobilization with the sling or splint, a pain management. And then after medical treatment, physical therapy is essential to restore strength, range of motion, and stability to the joint and help prevent future dislocations. So when dislocation occurs, follow protocol, which we have first aid, medical care, and physical therapy. So first aid, do not try to reposition the joint yourself. Serious nerve, ligament, blood vessels will be completely damaged if you try to move it and push it back into its socket. So first, we're going to seek medical help. So go to an emergency room or call emergency services, especially if the joint is severely deformed or there's numbness. You're going to immobilize the joint using a splint to keep the injured area from moving, keeping it in the same position. So try not to move it at all. Apply ice, applying an ice pack to the injured area for about 20 minutes at a time to help reduce the swelling and pain. And then you want to also rest the joint and avoid painful movements. Then moving on to medical care. So, professional reduction. A healthcare provider will use a technique called a closed reduction to carefully guide the bones back into their correct position. This may involve sedation or anesthesia because it's extremely painful. And then moving on to immobilization. After reduction, the joint will be immobilized with a sling or splint for several weeks to allow the surrounding tissues to heal. And then pain management. Over-the-counter pain relievers can help reduce the pain and inflammation, and a doctor may prescribe stronger medications for a short time. And then we have imaging. So x-rays are typically used to confirm the dislocation and rule out any other fractures. And then lastly for that part, surgery. In severe cases, especially if ligaments are torn or if there's a nerve or blood vessel damage, surgery may be necessary. And then the last part, which we have physical therapy. So, restore range of motion. Once the initial healing has begun, a physical therapist will guide you through gentle exercises to help you regain the full range of motion in the joint. And then strengthening muscles or strengthening exercises. The physical therapist will create a specific program to strengthen the muscles around the joint. Strengthening the rotator cuff and other stabilizing muscles is crucial for preventing future dislocations. And then lastly, you're going to be following doctor's orders. So adhere to the exercises, schedule, and any other instructions from your doctor or physical therapist to ensure a full recovery. And then moving on to prevention and management. Preventing and managing joint dislocation involves a combination of strengthening and the surrounding muscles using appropriate protective gear and adapting lifestyle changes that minimize injury risks. So we have prevention strategies, protective gear, and lifestyle changes. We're going to start with prevention strategies. So, prevention strategies. So, we think about the exercise and physical therapies. They target exercises that are key to building an internal brace of strong muscles around the joints, which improves stability and reduces the risk of dislocation. So, these include strengthening exercises, which focuses on building muscles around the vulnerable joints. For shoulders, like the rotator cuff and the scapular shoulder blade, stabilizers are crucial. Examples include resistant band exercises, internal external rotations, shoulder blade squeezes, and wall push-ups. For hips and knees exercises, like squats and glute bridges and resistant band routines can also help tremendously. And then we're going to be moving on to the flexibility and range of motion. Incorporate daily stretching to maintain flexibility and prevent stiffness, but avoid overstretching, which can cause instability. Gentle movements like pendulum swings and wall crawls can be effective for the shoulder. And then warm ups and cool downs. Always warm up before physical activity and cool down afterward to prepare the muscles and joint for exertion. And then we're going to be sorry. And then also right here, balance and coordination. So balance and coordination activities like standing on one leg or using an unstable surface help retain your body's sense of joint position, improving reactive stability to unexpected forces. And then moving on to protective gear over here. So protective gear is using appropriate safety equipment can significantly reduce the risk of injury during high impact activities. So these include the brace and supports. So for individuals with a history of dislocations or joint instability, a doctor may recommend wearing a brace, sling, or athletic taping during high risk activities to provide additional support and limited excessive movement. And then sports specific equipment. This includes always wearing the recommended protective gear for the specific sport, such as shoulder pads for football, shin guards for soccer, and brace elbow pads for activities like roller sports or basketball. And then the last column, which is lifestyle changes. To maintain a healthy full recovery, these include maintaining a healthy weight. So, excess body weight puts additional strain on the weight bearing joints like the hips and knees. Practice good posture. Be mindful of posture to reduce unnecessary strain on the joints. You also want to avoid high risk movements. If you have a history of dislocation, avoid activities or movements that stress the joints, such as lifting heavy objects overhead or contact sports, until cleared by a healthcare provider. And then ensure environmental safety. So remove the tripping hazards from your home and use proper tools, a sturdy ladder instead of a chair, for example, to prevent falls. And then lastly, listen to your body. Avoid playing through the pain or overexertion. Rest is essential for preventing fatige induced accidents. And then here we have a little bit of, the prevention, the protective gear, and like the lifestyle changes. Or like right here, it's more so like the time span of when the dislocation is healing, like the healing process of it. And then lastly is my citations. I hope everyone enjoyed my slideshow and learned a lot out of it, and have a good one.